The CMPA is looking to understand how AI technologies can help physicians in practice, and how physicians can minimize their medical legal risk while using these technologies. I'm going to talk about some of the key points from our position paper on artificial intelligence. You can find the whole paper on the CMPA website. What exactly is AI? There's a lot of hype and attention about AI among physicians. What does it mean for me? Will it impact patient safety? Will it make my life easier? Another common question we get is, will AI replace doctors? More likely, it will augment your practice, and we don't see it replacing doctors anytime in the near future. There are many definitions of AI, but I find it helpful to think about AI having three characteristics. The first characteristic is that data are central to AI. It is the most valuable aspect, and different data into the same algorithm will result in different outputs and different behaviors. The second thing to keep in mind is that AI learns as more data are provided to it. So technically, the only limit for some algorithms is the amount of computing power and storage that is provided to it. Learning from data is how it improves over time. However, if you feed it the wrong data, its outcomes will worsen, and this can be called drift or model drift. The final point is that there is some degree of autonomy. AI performs a task on its own. The key thing to remember is, even if an AI does something on its own, someone is always accountable for the outcome. And in a patient context, that is generally going to be the physician. So knowing what we're talking about when we're talking about AI can really help physicians understand whether a given tool really is AI. This adds to the complexity of determining how and if you should use these tools. Not all artificial intelligence has the same risk. Let's look at the various risk levels of various AI tools. Now, remember, AI is an umbrella term for a whole bunch of technologies, and not all of these technologies have the same level of medical legal risk. If you're considering AI in your practice, think about two factors: patient impact and the level of autonomy the AI has. We have a matrix at the CMPA of how this can help you make sense of this. At the bottom of the matrix, we have things like wellness apps, clinical workflow, things that can help you in your practice day-to-day. These are things that don't really have a direct patient impact, and the AI doesn't have a high degree of autonomy here. So the risk level is lower. As you move further up the risk matrix, there are technology that supports recommendations for care. This includes diagnostic reasoning and differential diagnosis. Suddenly, the accountability level is higher, and so is the patient impact. And the medical legal risk is higher as well. Technologies which exhibit a high degree of autonomy, automatically assessing medical images with little or no physician input, or ones that interact directly with the patient in high-risk areas, such as robot-driven or robot-assisted surgery, then we are in the higher risk areas. Think about the specific characteristics of that AI tool. This should inform the steps required to safely adopt the tool. The mid to lower risk technologies are less likely to undergo regulatory scrutiny, and so you may have fewer assurances on their safety and efficacy. Ask yourself, what information do you need to be comfortable here? And what are your professional requirements? The CMPA is here to help you understand the medical legal lens of these technologies. Don't hesitate to go to our website or call us, and we'd be happy to help you. And just remember, whether you accept an AI tool's recommendations or deviate from it, it's always wise to document the thinking behind the decision. Remember, even if you're using AI tools, you remain accountable for the care that you provide. Bias exists in AI. Let's talk about where AI can get it wrong. All systems will have different degrees of reliability, accuracy, and robustness. But there is a particular type of error that we are seeing in more and more conversations. First of all, a defining characteristic of AI is that it is based on the data used to train it. These data may be skewed, out of date, and they may even contain false information. So an AI tool may incorporate all of the biases, misrepresentation, and other issues and challenges that come from the humans who created that data in the first place. We need to be aware of some of the historic harms from bias in medicine and society, and ensure that our use of these tools does not perpetuate these harms. So the data may have insufficient sample sizes for certain patient groups. It may lack important context like social determinants of health. The designers may not understand the certain context of certain patient groups or demographics, or how the tool could be used in practice. Being aware of the overall objectives of the AI can help you determine whether this tool will help you in your practice. Finally, there is a degree of autonomy of artificial intelligence. It will perform some tasks on its own, but the outputs, recommendations, or actions of AI should align with your own judgment and your standard of care. So, given all of this, we can say all AI might be biased in some way. And unfortunately, the industry is still in its infancy in terms of being able to assess and measure the bias of an AI tool. You should also ensure that you can review the outputs to minimize the potential biases in that manner. A common application in clinical practice are AI scribes. If you're considering an AI scribe, first, conduct your standard evaluation that you do with any tool. Ask yourself, does the tool meet regulatory and privacy requirements in your jurisdiction? How will it improve my practice and my workflow? And is it safe, effective, and reliable? Because we're talking about AI technology, there are additional considerations that you need to think about. More and more colleges have policies or guidelines that speak about how AI should be used. The colleges generally encourage proceeding with caution and with a particular focus on transparency, accountability, and patient consent. Let's talk about how AI scribes work. First of all, they record your patient interaction. So questions to consider at this point might be, who can access these transcriptions? Will they be used in any way to train the next generation of algorithms? Remember, you need to get meaningful consent from your patient, not only about being recorded, but also about all the potential uses of their data by the AI tool or the AI vendor. The AI then turns the transcription into a summative text. You need to understand, will this summarization be accurate? And will there be biases in the summarization? So let's think about biases. Think about how your patients might be different. Is their first language something other than English or French? Do they have accents that an AI tool may have difficulty understanding and capturing? This will help you to determine when to pay special attention to the summary this AI scribe creates. Finally, we recommend you consider how easy it is for you to review the output, verify its accuracy, make any annotations, and approve the summary and move on. So these are some of the things we suggest you think through if you're thinking of using an AI scribe in your practice. Let's talk about how these tools can develop for physicians more broadly and what we hope to see. We want to see AI use evolve in a way that doesn't place the onus entirely on physicians. We know we need to work together to do this right. And we call on developers, vendors, regulators, healthcare providers, leaders in healthcare, and medical associations and federations to work together to integrate these technologies into practice appropriately. One area that we'd like to see collaboration is on reducing fragmentation. And fragmentation is happening in our privacy, safety, how we look at bias, and risk management. So, for example, data privacy laws are province-specific, and the differences province to province make it hard for vendors to develop products for Canada nationally. It can also be confusing for physicians to know what regulations to follow. So less fragmentation and more alignment in our key laws and regulations mean better AI technology for physicians and Canadians. We're also asking that vendors be transparent about AI. Transparent about how they're developing the tools, about the capabilities and limitations, and the known biases. We also believe that physicians should be integrated throughout the AI lifecycle. Physicians can be instrumental in supporting the conception, development, design, and testing of AI technologies, and that will actually help us to have better AI technology for patients and for physicians. Finally, we encourage all key players to work together to address key gaps. So, for example, we can look at things like curriculum development and education about AI literacy. We know that regulatory frameworks and AI oversight in medicine will evolve. We also know that the potential benefits of AI in improving care and reducing administrative burden will depend on action by all stakeholders. What we want physicians to know is that CMPA is here to help you understand AI, its risks and benefits. If you have further questions, don't hesitate to go to our website or call us and we'd be happy to help you.